The spread of monkeypox across the world and also right here in the United States is slowly climbing tonight. According to the CDC, there are at least 30 cases of the virus now in the United States. Today, the CDC raised its travel notice to level 2, now recommending that travelers take precautions. But should the general public be concerned about monkeypox? Dr. Monica Gandhi is with the University of California, San Francisco, specializes in infectious diseases. Appreciate, as always, to have you on the program tonight, Dr. Gandhi. CDC has raised the level alert to 2. What does that mean exactly?
Well, in their definition of level 2, it means that be cautious if you've just traveled from a place in Europe or Canada where this is happening more often, where they're seeing more cases. We've had about 715 cases worldwide that's been identified according to the WHO. And there are places, this is called a non-endemic outbreak, meaning not in West Africa, not in Central Africa where it's usually found, but in places in Europe, Australia, Canada, and the US. So if you just return from a big place that it could be happening more like the UK, then take travel precautions. I will say it doesn't seem like it's going to affect the general population to the degree that level 2 usually merits, because it is sort of clustered right now more in men who have sex with men, which, not to stigmatize that group, but just to say we need to be aware of that so that they can be alert, the community can be alerted, and I, as an HIV doctor who takes care of this community, can be alerted. It's just to say that it's mostly in that population.
So who is most at risk right now? Is it that group?
Yes. So, for example, of the 21 cases described yesterday and now 25, it looks like all but one are in men who have sex with men. And they're most often have been linked to travel to places where this could have happened. In Sacramento, it looks like there was contact between people. That's probably from close skin-to-skin contact and also the very close respiratory contact that happens during sexual activity. It doesn't look like it's definitely not airborne, and it really takes a lot of contact to get it, which is why we don't think it's a major risk to the general population.
Despite that, though, there is a discussion about a vaccine to combat monkeypox if it were to get worse, and heaven forbid it does, ramping up production in the next few years. What more can you share about preparedness here in the U.S. for a virus like this?
Yes. So this is the most important part of it, that before we get worried about something, we should know there are actually completely vaccines available for monkeypox. It's the same vaccine that we used for smallpox. They're very closely related. They're both called orthopox viruses, DNA viruses. Probably we have much less smallpox immunity in the world because we stopped smallpox vaccination after that got eradicated. But this vaccine works extremely well. The production is being ramped up, and it should be given, this monkeypox vaccine, to those who are very close contact with someone who just was diagnosed with monkeypox, like a healthcare worker, a partner, someone who's in close contact. We want to prevent it. So we are ramping up production, and that will be the way to stop it as well.
What are the symptoms of monkeypox?
So it's actually quite distinctive. They are fever at first, kind of a prodrome, not feeling well, big lymph nodes, which is a big hallmark, and then a very distinctive rash, which the rash is very distinctive in that they look more like pustules, like they look like blisters that are filled with pus, as opposed to kind of so many rashes that are more vesicular or flat. They are usually used to be more on the hands and the feet, but because this is more from this close skin-to-skin contact, we have been seeing more genital and anal lesions, but really distinctive looking. And we have to distinguish between secondary syphilis and this, but they look exactly like those lesions. And they're very clearly, now that we know the risk groups, we're all on alert. We can say, okay, I think you could be exposed to this. I'm going to unroof those vesicles, give a sample, and diagnose this.
Okay. Before I let you go, masks are being recommended for travelers from the CDC. Is that in general or just for international travelers who have gone overseas? What would you say?
Yes, I mean, it is not really probably going to be prevented by masks, just based on what I just told you. It's really close skin-to-skin contact, and also the really close respiratory contact, which I doubt you're having with someone on a plane. So I really don't think that was necessary to say masks. We can certainly use masks on a plane for COVID or for other kind of more easily spread respiratory viruses, but this takes a lot of close contact, and we're not doing that on a plane.
All right, the more you know. Let's hope we're not. All right, Dr. Gandhi, good to see you as always. Thank you. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.